Hello to our community partners and friends. We are going through some challenging times. We at ANX Home Health and Hospice are here to combat COVID-19 with you. We all need each other's support. Per Martin Luther King's message, he said, "The ultimate measure of a man is not where he stands in moments of comfort and convenience, but where he stands in times of challenge and controversy." We have prepared this Zoom-in service for you. Let's make it fun and interactive. And thank you for your continued support. Without further ado, we present you JeoPPErdy.
Hello, my name is Justin and I'm a medical social worker with ANX, but tonight I'm going to be your host. Today we will be discussing infection prevention and control, focusing on how you can use these equipment to protect yourself. We'll have 4 categories. Our first category will be infection prevention and control. Our second category will be precautions. Our third category will be putting on or donning PPE. And our fourth category will be removing or doffing PPE. We'll have a question and answer segment at the end of our show. Now let's go ahead and introduce you to our panel of experts.
I am Nova and I'm the Associate Director of ANX Hospice.
I'm Geraldine, RN Clinical Case Manager with ANX Home Health.
Aaron Joseph Yanga, Virgo, RN Clinical Case Manager at ANX Home Healthcare.
Our first category is infection prevention and control. Question 1 under infection prevention and control. What does PPE stand for?
Personal protective equipment are protective clothing, helmets, goggles, or other garments or equipment designed to protect the wearer's body from injury or infection.
Question 2 under infection prevention and control. Name all PPE used in healthcare.
The PPEs are shoe covers, gowns, goggles, eye shield, mask, gloves, and hair covers.
Question 3 under infection prevention and control. True or false, eyeglasses can be a good substitute for face shield or goggles.
The answer is false. Eyeglasses cannot replace a face shield or goggles. You can continue to use your eyeglasses under your face shield. Face shield intends to cover your eyes against flying particles and splashes, and it provides additional layer of protection for your face as well as your eyes.
Question 4 under infection prevention and control. What is the most effective way of preventing infection?
The answer is hand washing. We will be showing you a short video about proper hand washing.
Inspect ourselves for any accessories. Remove any watches, any hanging jewelry, and if you have hoop earrings or any that dangle, please remove them. If you have any studs, we can cover it under the hairnet. Once you've observed yourself, no jewelry noted, we'll proceed to hand washing. So with the hand hygiene, we're going to use a hand sanitizer, about a quarter size on your palm. You're going to lather your palms as such. Once lathered, you're going to take your right palm onto your left dorsal, and you're going to interlace it as such. Okay, and then vice versa. From there, you'll transition to your thumb. Take your right palm onto your thumb and rotate, and then vice versa. Okay, so now that we've cleaned the thumb, what you're going to do is take the remaining fingers you have and in an up and down motion into your palm. Alright, that'll get under the nail bed, and then vice versa. Okay, and then from there you will interlock your hands and go in a rotational motion. Okay, and then once your hands are dry, your hands are safe.
Our second category is precautions. The first question under precautions is, what are standard precautions?
What is standard precautions? Standard precautions are basic measures used for all patients at all times.
The second question under precautions is, what is one way in which the COVID-19 virus is transmitted?
So one way COVID-19 could be transmitted is through droplet transmission. Droplet transmission happens when microorganisms are propelled through the air via coughing, sneezing, talking, and that's why we always reiterate to keep your distance at 6 feet.
The third question under precautions is, what is another way in which the COVID-19 virus is transmitted?
Another way of transmission is through contact transmission. So this happens between body contact against body contact, another person, or maybe another person who came in contact with someone who is infected. Another way is body contact through your hands or skin surfaces or any parts of your body onto a table wherein someone sneezed and was just plain talking, and the virus was attached to the table. So that's another way. So it's really important to keep all surfaces clean, tables clean, always wash your hands in between.
The fourth question under precautions is, what type of precaution should you use when cleaning an incontinent patient with diarrhea?
So how do you take care of an incontinent patient with diarrhea? So what we need to remember is that we always need to wear our gloves and gowns, and this is because to protect yourself and to protect the surrounding surfaces around you, and also to protect the patient as well and anyone who will be in close contact.
Our third category is putting on or donning PPE. Question 1 under putting on or donning PPE is the sequence of putting on PPE in this video correct?
So with the hand hygiene, we're going to use a hand sanitizer, about a quarter size on your palm. You're going to lather okay. And then once your hands are dry, your hands are safe. Don shoe cover. Now if you touch your shoe, if you're not, just wash your hand. 2, apply the gown. You'll apply the head on first, and from there, you will push your arms through the sleeves. You want to ensure that your back is fully covered, and if you have a buddy with you, it's always good to have them check at the end. Proceed to tie your gown. If the strings are long, you can tie them to the side as well. Okay. And then inspect yourself if you have any openings. Okay. Once properly secured, we will proceed to the next step. We will put on the face mask, face shield, and then the hairnet. Next step, you will don your face mask. Identify which is the front and the back. They will be different for each supplier. Once you've identified, place the back part on and then stretch out your mask. It's important at the bridge of your nose, you form that bend around it, and then as well as underneath your eyes to secure the fit like such. Next step, we will don the face shield. Don face shield. Okay. Like such. Next step, we will don the hairnet. Now this is going back to, with your earrings, be mindful of them. And when you put on your hairnet from the front to the back, be sure to cover your ears as well. All right, ladies, if you have long hair, tie them up. Last step to donning your PPE will be the gloves. Get the gloves that fit you properly and cover over your gown sleeve. And now you've completed your donning of PPE. Correct.
Question 2 under donning PPE is, what is the first PPE that you don or put on?
The first PPE you will don or put on will be your shoe covers. Your shoes are the most contaminated part of your body, so if you were to don that last, you will run the increased risk of contaminating your other PPE.
Question 3 under donning PPE is, what is the last PPE that you don or put on?
The last step to donning your PPE will be your gloves. The reason being your gloves is because you want to ensure that you have clean hands before performing any patient care.
Question 4 under donning PPE. What parts of your face must the mask cover?
The parts of your face that you want to be covered by the mask are your nose, mouth, and chin. Cue video.
Our fourth category is removing or doffing PPE. Question 1 under doffing PPE. Is the sequence of doffing or removing the PPE in this video correct?
Now that we're outside the patient's room, we're going to begin doffing our PPE. The first step will be removing your shoe covers. Be mindful of your balance, as you are in a clean environment and cannot touch your environment. Grab the back of the heel.
Go.
Once you remove your shoe covers, we will proceed to remove your gown. Untie the knot. Be mindful that it does not touch the ground. And then you'll proceed to remove the necktie. You can snap it as such if your gown is made that way. Now, one method we use is to shake like such. So what you will do to prevent the gown from touching the ground, you will ball it up like such. And as you do so, your sleeves will come off. You want to keep your hands in front of you and be mindful not to touch the front of your PPE. The next step from here is you will remove your hairnet, making skin-to-skin contact from the back to the front, and discard as such. Next step, when removing the face shield, you'll grab from the back side, chin up. After removing your face shield, remain with your chin out, and this step here is important to remove the face mask from behind the ears, forward, and discard as such. Now, with the last step of removing your PPE is the most important step. Hand hygiene before seeing your next patient.
Yes, that is correct. So you remove your shoe cover first, and then your gown, your gloves, your face shield, your goggles if you have one, and then your hairnet, and your face mask will be the last one.
True or false? There is no need to perform hand hygiene immediately after removing PPE since gloves were worn.
That is false. You want to make sure that your hands are clean. before you go to your next patient.
Question 3 under doffing PPE. Besides mask, eye shield, gloves, gown, shoe covers, and hair cover, what else do you need when you're doffing PPE?
You want to make sure that you do have some sanitizer to do some hand hygiene and wash your hands, and also some trash bin to dispose your PPE properly.
Question 4 under doffing PPE. What is the recommended way to remove PPE while also protecting yourself?
To remove it safely, make sure to roll it inside out, just like this video.
Tie the knot. Be mindful that it does not touch the ground. And then you'll proceed to remove the necktie. You can snap it as such if your gown is made that way. Now, one method we use is to shake. Like such. So what you will do to prevent the gown from touching the ground is you will ball it up like such. And as you do so, your sleeves will come off.
That completes our categories. Our final question is, are we ready to address this pandemic? For that answer, I turn it to Lucille.
The answer to that question is the question itself. Are you prepared both mentally and emotionally? We are going through some tough times during this pandemic. Fear and anxiety can be overwhelming, so we all need to remain focused. You have to answer this question. Do you have the proper equipment and supplies at work and at home? Every single one of us can do our part in combating this COVID-19. Take everyday preventive steps. Wash your hands frequently. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with a tissue. Clean and disinfect frequently touched objects and surfaces, and maintain social distancing, which is about 2 arms length. We hope you enjoyed this in service. Thank you again, my fellow team members, and take care.